So a warm welcome to everybody attending this webinar about the essentials of transplant nursing in Europe. As today's moderator, I would like to first introduce myself. My name is Rutger Groothuis. I work as a physical therapist and staff advisor in the University Medical Center of Groningen, the Netherlands. And I chair this session with Karin Edlund, who will now give a short introduction of herself.
Hi everyone, my name is Karin Edlund. I am an advanced transplant nurse from Sweden. I work as patient coordinator for liver and multivisceral transplant candidates at 𝘃𝗹𝘂𝗲𝗯𝘀𝗲𝗱 University Hospital in Gothenburg. Rutger and I are both members of the ETAHP board. We are honored to be your host for this webinar. We hope that the program will be of value and in times of pandemic restrictions that we will feel a little bit more connected in the European transplant community. Maybe inspired and hopefully a little bit wiser when we wrap up in an hour from now. Welcome.
So before we go on, I would like to start with a poll to check which professions are attending this evening. Sean, can you run the poll? So I think everyone can vote now. We're still voting. Okay, and there are the results. I hope everyone can see the results. Nurses are attended good this evening. Some physiotherapists, non-dietitians, and we have some physicians too. Great. And some others. It's always curious about the others, but we will see later. Okay, thank you. Before we go on, I would attempt that the next hour we will highlight the following topics resulting in the following program. The transplant nurse as a valuable member of the transplant team, the advanced nurse practitioner running the outpatient clinic, advanced education for transplant nurses in Poland, and at last, the transplant nursing research in Europe, an overview. And these topics are in line with the mission statement of the ETAHP. I think it's coming now, yeah. Because our mission statement is to connect nurses and allied healthcare professionals in the field of organ transplantation in order to optimize transplant care management. And sharing and increasing knowledge of these aspects will support nurses and allied healthcare professionals in providing excellent care to transplant candidates and recipients. So now Karin will notice some rules during the webinar before we will go on to the next phase. Yeah.
Thank you. During the seminar, you are more than welcome to chat with the panelists. Please write your question or comment in the Q&A field, and Rutger and I will share your question in the Q&A session.
Okay, I will now introduce the first short documentary movie about the transplant nurse in the spotlight, about two transplant nurses working on the surgery ward of the University Medical Center of Groningen. Especially it's good to notice that it's only one transplant nurse, but it's a very good one. So let's introduce to the video, or go on to the video. Thank you.
My name is Rodney. I work as a transplant nurse in the gastrointestinal and liver diseases department at the University Medical Center in Groningen. On our nursing ward, patients are screened for liver and small bowel transplantation. As a nurse, I am mainly concerned in the screening phase with discussion with the colleagues about the patients. executing an examination at the patient and observe the behavior of the patient, clinical assessment during the screening phase, and support during the waiting list. Many examinations take place during the screening week. These are aimed at detecting any problems that may arise during the transplant or afterwards. Not only physical examinations take place, the patient will also be screened psychologically by the nurse practitioner and seen by a dietitian. The main task is to provide information about the screening as clearly as possible. For example, what does the screening entail and which examinations will take place and why these examinations. Another very important task is to observe the patient's behavior. Does the patient stick to agreements? Is there adherence to therapy? This is very important for the post-transplant phase to avoid potential problems. It's very special to be a small part of a major phase in the patient's life. Guiding the patient in this intense period makes me realize more and more how valuable a healthy life is. That is why I will try to do everything in my power as a nurse to contribute this for the patient. My ambition is to make the transplant section larger on our nursing ward, so that it really becomes an expertise within our specialism. I'm very proud to work at this amazing transplant center and team as a transplant nurse.
So, beside the screening phase, highlighted by Rodney, the nurse also plays a key role in the post-transplant phase. And there are a few aspects I would like to mention. First of all, the nurse is involved in monitoring the patient by observing the patient vitals, the fluid balance, the wound and doing wound care, and the mental status. Secondly, the nurse is also involved in mobilizing the patient after surgery, often in cooperation with the physical therapist. And at third, the nurse gives education to the patient about preparing on the discharge and the home situation. So he gives education in personal hygiene, medicational use, and adequate self-care.
Well, now we are moving on to a second documentary video. This time we will focus on a kidney transplant clinic at Erasmus University Medical Center in Rotterdam. Marleen van Buren will present her work as a nurse practitioner in a multidisciplinary team. With extended medical mandate, a nurse practitioner is entitled to screen, guide, and treat kidney transplant patients and living kidney donors. Marleen is currently the Vice Chair of ETAHP. Enjoy.
Hi, I want to give you an insight in my job as a nurse practitioner at the kidney transplant department at the Erasmus Medical Center, Rotterdam, the Netherlands. I work at the kidney transplant department together with 5 other nurse practitioners.
𝘃𝗹𝗂𝗲, Louise Maasdam, Kelly Muller, Erika van Stralen en Mireille Houthoff.
Nurse practitioners are a relatively new profession. It started in 1965 in the United States due to shortage of general practitioners in the rural areas. Since 1997, nurse practitioners are an official profession in the Netherlands. So, how do you become a nurse practitioner in the Netherlands? First, you have to finish your Bachelor of Nursing. This takes 4 years. After this, you need 2 years of working experience as a registered nurse. The master program you have to follow is called Advanced Nursing Practice and takes 2 years, and it's given at the University of Applied Sciences. But first you need to apply for a traineeship at the hospital, general practitioner's office, or any other place in the healthcare system you want to work as a nurse practitioner.
As you can see here, it depends per country what your title is when you have finished your Advanced Nursing Practice Master.
As a nurse practitioner at the kidney transplant department, I am responsible for the screening of living kidney donors. I work closely with the nephrologist of our team.
At the transplant surgery, the nurse practitioner decides with the transplant surgeon which kidney is suited for donation. When a kidney transplant candidate has no living donor and is accepted for the deceased donor wait list, the nurse practitioner keeps in contact with them every year to make sure their medical status stays up to date and to support them in a difficult period of waiting for a kidney. As a nurse practitioner, you are an important part of the multidisciplinary team. You have to present and discuss the kidney transplant recipients and donors you have seen at the outpatient clinic during multidisciplinary meetings. Also, the nurse practitioner does the daily rounds at the clinic for living kidney donors. She prescribes medication, she checks the condition of the donor and the wounds, and she takes care of a smooth discharge of the donor. During the daily rounds at the clinic of the kidney transplant recipients, the nurse practitioner assists the nephrologist and transplant surgeons. When a kidney transplant recipient is ready for discharge, the nurse practitioner educates the kidney transplant recipient and their significant others on lifestyle and medication after transplantation, with extra attention for self-management and medication adherence. After discharge at the clinic, the kidney transplant recipient's follow-up at the outpatient clinic is done alternately by the nephrologist and the nurse practitioner. As a nurse practitioner, we combine care with cure. We check the lab results, prescribe medication, but also have special attention for medication adherence and self-management, and we can also remove stitches or bandage a wound, or perform an ultrasound of a kidney transplant.
Born on the island of Aruba. I lived all my life in the United States. Met my partner also in Aruba, and we moved here and been living here now for quite a while. And of course I got ill here with kidney disease. It got worse, and Marleen decided that she wanted to donate her kidney. I was against it because she's my partner, and she's not the same blood type, which made it very, very special. It happened in 2018, the end of June 2018. And it's been going well ever since. And I'm really grateful for all the nurses and doctor that helped me through this whole procedure.
Yeah. Did you notice any difference between a nephrologist and a nurse practitioner?
Well, no, actually, I felt they were pretty much the same because they had great interest in how I felt and what I needed to continue in being healthy. So the nurse practitioner that I have still, really wonderful people, and they've really been supportive, and any complaint or anything that I need, they're there. And they understand and they listen, most importantly, listen. You know, meaning that I could tell them also medically, and they also respond medically, but also on a personal level, because I think that's really important, that to know how my lifestyle is and what I'm doing. So, yeah.
The Erasmus Medical Center is one of the largest living kidney transplantation centers in Europe. Therefore, we found our living donors very important, also after donation. We provide them lifelong annual care, and the nurse practitioners are fully responsible for that care. After donation, they receive a special gift from the National Kidney Foundation.
Giving education to nurse students, medical students and colleagues is an important task of the nurse practitioner. As a professional with a master's degree, the nurse practitioner is expected to participate in research and be able to turn clinical questions from daily practice into research. My colleague has obtained her PhD on medication adherence. Another colleague does research on health literacy, and I hope to finish my PhD this year on pregnancy after kidney transplantation and kidney donation.
In my job as a nephrologist, I cooperate on a daily basis with nurse practitioners, especially at the outpatient clinic. I think that the cooperation with nurse practitioner greatly improves patient care and patient outcome, and moreover it reduces the burden of work that we as nephrologists have, because we can still see a lot of patients in a relatively short time. The added value of a nurse practitioner after transplantation is that you can work together as a team with each team member focusing on what they can do best. And there we can share our thoughts and discuss how we want to approach this patient, because nurse practitioners and nephrologists, they look at a different way to a patient, and the discussion between them can give insight in how to approach a patient. So in conclusion, I think that the collaboration with nurse practitioners greatly improves patient care.
Collaboration with the nurse practitioners is excellent. It is a very, very intricate part of the program. I think it is very important that that you have people who are dedicated for the program that you work for, that are very knowledgeable, mostly much more so than even the residents that join the program, and are dedicated to giving the best care that is possible for the patients, and also have a specialty training to be able to do this. And the collaboration is a very easy one. We're part of the same team. There's no hierarchy. It's really that we together want to give the best effort and the best results for our patients. They also take care of the personal aspect with the patients, so they have more time to talk with the patients. They have more time to hear complaints that generally during rounds or during outpatient clinic are not really available. So if I'm busy, I only have like 15-20 minutes, but a nurse practitioner might be able to find more time to actually talk with the patient, so it gives them more confidence in the entire program. And they are very versatile, so they can help out in any aspect of the program. Usually it's their expert value, their expert knowledge about the kidney transplant program that make sure that they can educate other nurses, they can maintain quality in the program, so they check everything, they can double check everything, make sure everything is going to protocol. So it makes my job a lot easier knowing that I have a nurse practitioner that has my back.
So you've all seen what a terrific job I have as nurse practitioner. If you have any question, you can email us or you can follow us on social media. Furthermore, I want to take this opportunity to announce that our kidney transplant department has its 50th anniversary this year. Thank you for your attention.
Thank you. My warm thanks to Rutger and Marleen for your excellent job with these documentary videos. Now let's see if we have some questions or comments from the audience. Let me check. I can't see any questions so far. Can you, Rutger? No?
No, me neither.
No, okay. I wonder if someone is typing. Maybe I can ask you a question, Rutger?
Yes, that's okay.
Has the pandemic affected the daily work at the ward in some positive or negative way that you think will remain when it's over?
I think for the nurses, the most exhausting thing on the ward is that there's not exactly a finish line in sight. So it makes it very uncertain how long the whole situation will go on. That's the most negative thing, I think, because on the most crucial moments, nurses and doctors were mobilized to the COVID ward, and this gives even more pressure on the regular transplant care. But I think the positive thing is that there's a huge connection between the nurses and all the professions to face the same problem together.
Yeah, I agree. No question in the chat. Marleen, are you with me? In your opinion, what are the main benefits for a transplant center employing nurse practitioners to manage a clinic? We heard the physician's opinion, but what is your opinion?
Well, my opinion is, yeah, what I said in the video is that we can combine care with cure. So we can do our nurse task, but also combine it with more medical tasks. So like at the outpatient clinic, we can combine things like remove stitches or doing an ultrasound with prescribing medication and have extra attention for medical adherence. So I think that the combination of these two are the most positive for a nurse practitioner.
Okay, thank you. Actually, we have a comment from Annette Lenneling in Sweden. I know her. It would be nice to see you when you talk. Is it something you can fix, or do we have this slide all the time? We can't see you. Please tell us here. Actually, are the nurses already vaccinated on the ward of the transplant patient? We got another question. Who wants to answer that?
Well, in our hospital, not yet. But there's a part is vaccinated already, and but a part is still coming. So the intensive care nurses are vaccinated, and from the emergency care.
In our hospital, it's started. Well, the acute care nurses are already vaccinated in January or February, but now the other nurses are being vaccinated. So they started last weekend.
Thank you. No more questions so far. Maybe we shall move on then, Rutger. What do you think?
Yeah, great idea.
Oh, sorry. Just came in. How did the pandemic affect the living donor program? Remained active or had to stop? Marleen, what do you say?
Well, at the first beginning of the COVID pandemic in March last year, we stopped, but for a short period. But now we are going strong, but strong. The number, first we did 3 living donor operations in a week, but now it's like 2 or 3 in a month sometimes, because there's less operating room available. So that is a problem, but we still go on. But we do not do the HLA and ABO incompatible living donor operations.
Okay, we have time for a final question. It's from Fernanda Ortiz. I'm interested in the digital steps taken in the past years. The Netherlands have been shown the path. Can you explain how digital healthcare modified nurses work? Is it a question for you, Marleen?
Well, we just starting up in the Erasmus Medical Center. I know in other academic centers they have been started with this earlier, like in Leiden. I know we are now starting with more digital healthcare, so giving all the patients a blood pressure measurement at home and these kind of things. But we are now starting with it, so we are not on front. I think it's Leiden. I don't know how you felt about this, Rutger. How is it in Groningen?
We started with online video consulting. But I don't know exactly in which amount, but we started with it. And we also do at home, controls, check assessments, but I don't know exactly, but the video consultants are working really good, yeah.
A final question. It's from Anna Forsberg to both Rutger and Marleen. Do you think it would be beneficial with a specific education in transplant nursing?
Yes, I think it's really beneficial. In the University Medical Center Groningen, we started with education for the transplant nurses. So it's a 9-month during educational program where we learn the nurses everything about the several domains, including in transplant care management. So yeah, it would be very beneficial, I think.
Yeah, I do think so too. In Rotterdam, we do educate our nurses with special training once a year. We do that a whole week, and then all the specialists and nurse specialists come by and give education. But it's not like a training for a year or 2 years. It's like once a year we give a fresh refreshment of all the knowledge about transplantation.
And we will now hear an example from Poland about education, but my concern is that, for example, in Scandinavia, there are no specific education. It's mainly up to each center to educate the nurses. And I was thinking that perhaps transplant nursing in Europe would benefit from a more European education plan or a European curricula that we could share. Instead of each country inventing their own education.
And I think according to the time we move on in the program, is it okay? Rutger.
There's another question of Wolfgang with the Q&A.
What is the overlap in your country, the Netherlands, between nurse practitioner and transplant coordinator for recipients? It's Wolfgang from Switzerland who's posing the question. Is there an overlap, you think?
Well, I think it depends very much on what you see, what a transplant coordinator is for recipient, because I think that those titles are very different in countries. I don't think what a transplant coordinator has for education, but I think their tasks are very much the same, because a transplant coordinator also cares for recipients after transplantation, I think. So I really think it depends on the education and what the abilities are that you can do, because I can do as a nurse practitioner, I can prescribe medication and treat the patient independently, but I don't know how that works for a transplant coordinator in Switzerland. I don't know it depends on, I think, the education a transplant coordinator has. And what I learned is that it in every country depends. That's my experience, at least.
Okay, if there are no further questions, we can move on. We will now continue with a presentation of Irena Milaniak. She's from Poland, and from origin she's a nurse. But since 2020, she's a professor in health sciences and at the 𝘃𝗹𝘂𝗲 Hospital in Krakow. Her expertise lies in the field of thoracic transplant recipients in both research as clinic as well. I would say, Irena, the stage is yours.
Thank you very much. Good afternoon, everyone. Thank you very much for finding time and joining to our exciting webinar. Transplant nurses are a vital part of the organ donation and transplantation process, and without transplant nurses, transplant centers and program could not function. Overall, transplantology is very difficult field, so knowledge and skills of transplant professional are essential. So it is a pleasure to present topic concerning education in transplant nursing. So this is my disclosure. In 2008, the American Nurses Association and International Nurses Society published a statement regarding scope of nursing practice in the field of transplantation and defined transplant nursing practice as a specialized nursing care focused on the protection, promotion, and optimization of the health and abilities of both transplant recipients and living donor across the lifespan. So how to become a transplant nurse? Thorough comprehensive training and education is essential. So the first, get a minimum Bachelor of Science in nursing, then start work as a registered nurse in transplant field. You can optional pass the certificate clinical transplant nurse exam, for example, in some countries, and you are ready to work as a transplant nurse. The core competencies needed for transplant nurses include knowledge of transplant process, excellent communication and teaching skills, technological skill, and of course ability to work with interdisciplinary team. We can see it in our documentary film. Key elements of transplant nursing include patient education, intervention that maintain or improve physiological, psychological, and social health, intervention that facilitate optimize behavioral change and treatment adherence with complex lifelong therapies, and of course, research to broaden and enrich the knowledge base of transplant nursing. So nurses, transplant nurses may work in hospital, ambulatory surgery centers, and specialized organ transplant facilities. And the role transplant nurses in this setting focus on clinical care, coordination of care, and advanced clinical care. Educational requirements for transplant nurses vary by specialty, role, educational institution, and country. And transplant nurses can improve the quality of nursing care by pursuing certification in the field of transplantation. Certification is available through transplant organizations in North America and Europe with various eligibility requirements. So the following certifications are available: the American Board for Transplant Coordination, and it is, for example, Certified Clinical Transplant Nurse, Certified Clinical Transplant Coordinator, Certified Procurement Transplant Coordinator, and Certified Transplant Preservationist. In Europe, the European Society for Transplantation offered the Certificate of European Transplant Coordination in 5 separate modules, like general transplant coordination, donation after circulation death coordination, living donor coordination, recipients coordination, and tissue donation coordination. In Great Britain, there is a specialist nurse in organ donation, and these nurses are employed and trained by National Health Service Blood and Transplant, and it is dedicated for nurses who work in critical care in the emergency department or intensive care unit. In Poland, at a master level education, nurses can possess the necessary knowledge and skills needed to provide quality care for transplant donors and recipients. And the graduate of the Master Science of Nursing program will know principle of patient scan before and after organ transplantation, and can plan and provide nursing care for a patient with organ failure before and after organ transplantation. And the university proposed the courses concerning transplantation. And for example, at my university, we have a subject calling transplant nursing, and it lasts 15 didactic hours. At Medical University of Warsaw, the subject called Transplantology and Nursing Care for the patient after transplantation. We also have a postgraduate training for registered nurses. This is a specialized training or qualifying courses. And the framework for the program of anesthetic and intensive care nursing, surgery nursing, and internist nursing includes the educational effort concerning organ donation and transplantation. Another possibility to possess a specialized qualification is a qualifying course dedicated transplant nursing, and the total number of hours of this course is 250 hours, with 117 hours theoretical classes and 133 practical. After completing this qualifying course, the nurses receive a list of competencies. There are 8 competencies, and they can take laboratory tests. They can perform physical and mental observation and prepare patients before and after transplantation, planning and implementation of activities in the prevention of infection, monitoring and evaluation of the function of the transplanted organ, and of course they can prepare patient and family education. So as a home message, as a transplant nurse, there is this incredible realization that our patients have come to us for another chance at life. And we are there to help them through that journey as safely as possible. So thank you very much for your attention.
Thank you. Thank you, Irena. Questions will wait for the Q&A session. Now it is my pleasure to introduce our next speaker, Anna Forsberg. Anna is the chairman of the ETAHP board. She is professor in nursing science with focus on organ donation and organ transplantation. She has been a registered nurse for 30 years. She has mainly performed her clinical training and research at the Transplant Center of 𝘃𝗹𝘂𝗲𝗯𝘀 University Hospital in Gothenburg. In 2001, she defended her thesis entitled Health-Related Quality of Life and Coping After Liver Transplantation. In 2013, she became clinical professor in transplant nursing at Lund University, where she is now affiliated to the Department of Thoracic Transplantation. Before Anna gets started, we would like you to run a second poll. Please pay attention. How often do you consult nursing research? Once a week, once a month, once a year, or never? Please give us your vote now.
Do we have some exciting folk music?
Ta-da! You want me to sing, Rutger?
No, it's okay.
Okay, we hold it for 56 seconds, and once a week, 10%, 20% once a month, 6% once a year, and 6% never. Maybe you want to comment on that later on, but now the scene is yours, Anna.
Okay, thank you for this very nice introduction. And hopefully I can, for the next 10 minutes, inspire you to consult nursing research even more. I will give you a short overview of nursing research in Europe, and I have nothing to declare, and also you are welcome to share the details of my presentation. Well, for For the last years, we in the ETAHP board, where we are strongly involved in transplant nursing research along with other research, we have worked on this overview of research in Europe. And what we can see is that there are 3 strong research traditions in Europe. One tradition is focusing on live donation of solid organs, specifically kidney and liver or stem cells. There is also a strong research tradition regarding non-adherence and solid organ transplantation, which is a key focus for, I believe, all professionals involved in transplantation and very important aspect of transplant care. And maybe for the last 5 years, it has been a great interest and a strong focus on symptom management and self-management of the solid organ transplantation. And then we have also a little bit more specific Scandinavian tradition, I believe, where there also is a strong focus on person-centered care and a little bit more use of qualitative methods within the hermeneutic research perspective. Clinical nursing research, well, it's designed to guide nursing practice and to improve the health and quality of life of the patients, the clients of nurses. And if we take a look about the landscape, the research landscape in Europe, one of the most prominent researchers and research leaders are Professor Sabina de Geest. She's a professor in nursing, and she's the director of the Institute of Nursing Science in the University of Basel in Switzerland. And she has built a very successful and vivid research group focusing on behavioral and psychosocial issues with the ultimate goal of improving clinical outcomes, both regarding chronically ill populations in general, but specifically solid organ and stem cell transplantation. And she has also developed a strong research tradition regarding the prevalence and determinants and consequences of non-adherence to medication regimens. In Switzerland, maybe they are most famous for their BRIGHT study, which were a worldwide investigation on non-adherence, and they also are trying to determine the multi-level factors related to immunosuppressive medication. There are also a strong research tradition in Germany. It's led by Professor 𝘃𝗹𝘂𝗲, with a specific focus on patient-centered care for patients and families with chronic conditions. And they are mainly directed towards symptoms and patient self-management after cardiothoracic transplantation. In the Netherlands, you have met some of the researchers in this webinar, and the key centers in the Netherlands are the University Medical Center in Groningen and also the Erasmus University in Rotterdam. And in the Netherlands, there is a strong focus on self-management among kidney transplant recipients. Marleen, who you have met in this webinar, is writing a thesis about pregnancy in kidney transplantation. We have another member of the ETAHP board, 𝘃𝗹𝗂𝗶𝗋, who is interested in the psychological well-being after liver transplantation, and wrote a thesis about that. So there is a wide variety of important topics from a nursing and patient perspective. In Poland, the research is, one of the research leaders in Poland is Irena, who you just heard, giving a presentation about education. And they also have a strong focus on cardiothoracic patients, device therapy and heart failure, and also quality of nursing care in the transplant setting. Turkey is a part of Europe also, and they are having a huge transplant program, mainly focused on liver donation and living liver donation. And one of the key research leaders is a former ETAHP member, 𝘃𝗹𝘂𝗲 from the nursing faculty in Izmir, University of Izmir. And since Turkey is very strong on liver transplantation, they also have a lot of nursing research regarding liver transplant recipients care, live donation, psychosocial assessment, and also on pediatric liver transplant recipients care. Finally, in this presentation, I will just give you a glimpse of what we are doing in Scandinavia with a person-centered approach to solid organ transplant recipients. And the key focus in Sweden, mainly at the center in Gothenburg and the center in Lund, is self-management after thoracic transplantation, which is a nationwide study. There is also strong focus on the perceived threat of the risk of graft rejection and social adaptation and patient learning after organ transplantation. And we have one internationally renowned expert in living donation, which is Dr. Annette Lennerling. If you are interested in learning more about nursing research in Europe, I will direct you to these websites, the website of European Society of Organ Transplantation, and specifically the page where you can read more about ETAHP as a section, because there we highlight a much more expanded presentation of all the important research performed within transplant nursing in Europe. So my key take-home message to you is that transplant nursing research contributes to health, well-being, and life satisfaction in relation to organ donation and organ transplantation. Thank you for listening.
Thank you, Anna, for this beautiful presentation. We will now start with the Q&A session. I will have a look for there are any questions. Feel free to comment or to ask. I see a small addition from 𝘃𝗹𝘂𝗲 on the presentation of Irena. She tells in the chat that in the UK, in addition to what was listed for specialist nurses in organ donation, we also have organ-specific courses for the recipients. So a post-graduation in renal course, for example. Okay, that's nice. Are there any other comments or Q&A or questions? None. Okay. Irena, Anna, can I both ask you a question? And maybe Anna, I can begin with you. You both, Irena and you, are both gained a lot of expertise in psychosocial problems before and after transplantation. And is there a way to screen or to tackle psycho problems on the ward? For example, can a nurse screen or tackle psycho problems, and how could they do it?
Yeah, thank you for a great question. Well, I think the nurse has a great opportunity since she's in the caring relationship and she's close to the patient. And at that position, I think it's an opportunity to grasp the psychosocial issues of the patient. Sometimes I think the discussion about screening is difficult, because one thing is that during the evaluation, the pre-transplant evaluation, a majority of the patients, they want to survive. I mean, the key mission for them is to survive, and they do almost anything to be qualified for transplantation. And also they are suffering from their life-threatening illness, and some of them are cognitively affected. So I think the main psychosocial problems, I believe, occur afterwards. And I gave a presentation in the TDS Congress in Madrid a couple of years ago about how to improve psychosocial outcomes. And in that presentation, I developed a model where we identified the 10 most common psychosocial problems. And currently at Lund, we are, together with a psychologist, we are developing a program for how to handle how to develop and how the psychosocial care and how to handle the psychosocial challenges. So to conclude, I think that what we can do as nurses is to identify the psychosocial challenges in everyday practice, and also with a team approach, together with the psychologists and the other team members, develop guidelines or programs to how to handle it, because we know from when we do our research and when we do service to the patients, we know that psychosocial challenges are huge, and it's always a concern for the patient. I apologize for the very long answer.
Oh, great! It's a great long answer. I think it's great that you developed a specific program to tackle psychosocial problems, and it's good to pay more attention in general about this. And Irena, do you have additions on this or not?
Yes, thank you for the question. As Anna told, we need to cooperate with psychologists, so nurses cooperate with all team, especially with psychologists, to assess some psychosocial problems. And sometimes we can see the problems which don't see the psychologist. So I think it is essential in our practice. We have some tools to assess some problems like depressive symptoms or some problems in family with and social problems. And we try to solve it together. So not only nurses work with patients, but all team, and especially during the qualification process and after the transplantation, very often we try to help patients before going home.
Okay, thank you. So the multidisciplinary team approach is very important to tackle the problem. Yeah, yes. Thank you. I will have a quick look in the chat or Q&A again, but I again see no questions, so we will move on with the summary and the take-home message already. Karin, can you go on?
Yes, thank you. I would like to express a heartfelt thank you to Irena and Anna, and to the audience as well. To me, it has been an informative evening, and in summary, we have learned the following. The transplant nurse is a valuable member of the transplant team. A transplant center has a lot to gain from letting nurse practitioners run the clinic. Each transplant center should strive for an advanced education program for transplant nurses and allied healthcare professionals. A lot of interesting research, nursing research is going on in Europe. Stay curious about new research and share new knowledge with your colleagues. To continuously improve ourselves in increasing the value of our lectures, we now ask you kindly to participate in a final evaluation. Another poll. How useful, maybe the questions have to, yes, here we go. How useful did you find this webinar? Extremely useful, useful, fairly useful, not useful? Please give us your opinion now.
So thanks, I have the results. Thanks, Karin, for the great conclusion and the wrap up. The results of the webinar, it's useful. Thank you for all the attendees. It's nice to hear the webinar was useful, and this motivates us to organize more in the future. A lot of local quality and improvement work is going on in the transplant community all over Europe, and more nurses and allied healthcare professionals takes nursing knowledge to an even higher level by conducting research on their transplanted patients' experience in daily life. And we don't have to reinvent the wheel. So let's come together and share each other's knowledge and experiences on a regular basis. That would be very cool, I think. I have some small comment about the Twitter chat later this evening. Maybe we can go to that slide. Yeah, thanks. Anna and Marleen will organize the ESOT chat this evening at 9 p.m. So please feel free to join this ESOT Twitter chat. You can participate by following the ESOT on Twitter. So, Karin, then the last word is for you.
Yes, thank you. This webinar was a warm up before the big and exciting ESOT Congress in Milan, Italy, 29th of August to 1st of September this summer. We really hope that we have been beaten the pandemic by then, so we are able to meet face to face. We encourage you to visit our website and register for the Congress. Well, have someone in the panel something to add? No, well, then I would like to give you the following take-home message. It's a quote from Batalden and Davidoff. Everyone in healthcare really has two jobs when they come to work every day: to do their work and to improve it. Thank you so much for attending. Take care of yourself. Hope to see you in Milan. Good evening.
Thanks everyone. Good evening, and hope to see you in Milan. Bye.